first question, Francis, is we've put under a banner of, is there to be a harmonious approach to data between the UK FSA and EFSA? And the question that we've been asked to put to you is this: does the FSA intend to apply the same criteria as EFSA in respect of the data required and criteria to be applied thereto? If so, will validation and/or authorization by one body lead to automatic treatment by the other body?
Okay, so as I've said, we are continuing to use the EFSA guidance in the short to medium term, because the guidance, we were involved in drafting the guidance in the first place, so we obviously agree the contents of it. But over time, there may be possibility that we may want to change our guidance, and obviously that will be consulted on, and applicants will be made aware. But for the time being, anyway, we will be continuing to use the EFSA guidance. We will be outside the European Union by the end of, well, we're outside the European Union now, and come the end of this year, we will be a separate entity. So there may be differences between us validating a dossier and EFSA validating a dossier. So I can't guarantee that there won't be differences there.
Okay, thank you.
Francis, thank you very much for your time. We seem to have in the industry at the moment, and I'm just going to capture the next question in this, I think 3 different approaches when we're looking at the risk assessment and toxicology specifically. So we have a consortium approach, which we'd like to ask you some questions on, with a consortium approach to toxicological testing. We have individual companies who are sufficiently funded that they can undertake that themselves. And then we have a collegiate and individual approach, which is being offered by people, which is a desk-based approach to risk assessment. So in answering these questions, it would very much help if we could get an idea as to whether you believe from a risk assessment, whether in vivo, so rodent testing is required, or whether it is possible for somebody to support and deal with the toxicological elements and the risk and ADME from a desk-based approach relying on other data. So it would be very helpful if you could sort of consider that question as an overriding question when we go through them, if that's okay.
Okay.
So the first question is assuming in vivo rodent studies, so 90-day or 90-day plus study, OECD 408, and obviously I'm very interested to hear your opinion. If company 1 undertakes rodent in vivo toxicology studies on its CBD isolate, but for this we could say on its CBD ingredient and an MCT oil, will a second company, company 2, be able to utilize that same toxicology data of company 1 with the permission of company 1 in a separate novel food application for its own CBD ingredient in an MCT oil, on the premise that company 2 can demonstrate by reference to its production batch samples that its own isolate is substantially equivalent?
Simple answer, yes, but we really need to have information as to how similar or different the 2 products are. So we must have the specification for the product that's used in the toxicology study, as well as the product that is the subject of the novel foods application, so that we can compare the 2.
Okay.
The follow-up question to that is then, what would be the criteria necessary to demonstrate that substantial equivalence between the ingredients from the 2 companies? We appreciate that you need to have it to see it, but what are the criteria by which you would judge whether they were substantially equivalent to each other?
It would be on the specification and the composition of the products, but as you say, they would have to be considered case by case.
But what would it be about the specification that you would be looking to set the criteria against? Is it the purity? Is it the number of contaminants? Is it the volume of the contaminants?
It will be all of those.
And do you yet have a policy as to how equivalent something would be for you to be satisfied that it was substantially equivalent?
That would depend on our advisory committees. We haven't discussed this with them yet, and they are obviously the experts who will be looking at these, so we don't have that information yet, no.
Okay. On that, because I think it's very important, there are people committing very large amounts of money now, and putting aside one moment for the ethics, which we'll come to about there being multiple studies involving animals. People are proceeding on different bases. So some are making an assumption that a 5% variation in purity will be sufficient for a collegiate application. So if I can give you this further question, which has hopefully got sufficient specifics in it, and we've made it sufficiently narrow to hopefully receive an answer. So company one manufactures a CBD, and we're going to go for isolate here, manufactures a CBD isolate of a quality which is 99.2% CBD and 0.8% other compounds, which are consistent in their respective ratios batch to batch. So assuming we've got 5 lots of batch testing, and this is a very consistent product. Company 2 manufactures a different CBD isolate of a quality which is identical in that it's 99.2% CBD, but the 0.8% other compounds are consistent, but the ratio of the other compounds and or cannabinoids and or contaminants are different to that of company 1. Can the 2 manufacturers undertake toxicology studies, and for this I'm talking about, again, in vivo rodent studies, on the isolate of company 1, but from which they could both rely on the results in support of their individual applications?
Yes, we wouldn't expect a new toxicity study for both companies if they are able to work together. And so long as they are able to demonstrate that the specifications of the 2 products are similar, and I would say those numbers you've given there do show that it's very similar, but we would like to see a breakdown of the composition before we made a final decision.
So would you say 95% was similar? Is there a cutoff point? Because
I can't really comment. I need to discuss that with our advisory committee.
Okay.
I don't know. I don't have the answer for that.
Have the advisory committee given any indication about when they would be able to release that information, so people had parameters to work within, so that they could form these group studies or shared data together?
We're hoping to have a discussion with them in September, so they may be able to advise us a bit more from then.
Okay. Are you of the opinion that for a successful application, that in vivo toxicology will have to be undertaken?
I think it's clear that there are still gaps in the data, and I can go into those in a little bit more detail. I know there's a question later on where there's more detail on that. But there are clearly gaps in the data still, and these still need to be addressed. And I think in some cases these will have to be addressed using in vivo data. It is possible to use in vivo data on one product and use that to demonstrate the safety of another, but as I say, we need to be able to compare the composition and the specifications of those products so that we can make a judgment on whether it's adequately similar.
Okay. So looking at the Committee on Toxicology, they've raised, as well as the sort of recommendations on adverse effects, they've also talked about genotoxicity, and they've flagged a number of issues which lead a lot of us within the industry to believe that there will have to be some in vivo testing, which would, as we know, take perhaps 90 days and then a recovery period. We're not scientists, but from what we understand from scientists that we speak to, the planning of that work and the whole piece of work itself can take between 5 and 7 months. So if the industry isn't going to be given an indication until September or October, that would preclude them from being able to submit a dossier in time for it to be validated. So my question there is it prudent for somebody to work with all of the other elements of the application, await your guidance or the guidance that comes out in September of October, then plan toxicology work on the basis of that guidance and submit an application which has not got completed toxicology in it because it hasn't had sufficient time to be conducted.
So long as that is possible, so long as that we receive an indication of the timetable for the studies that are being commissioned, and an indication that the process has been begun, that we have started, the applicants have started to contact and discuss studies with relevant toxicology laboratories and started that process. So we would need that reassurance.
So to validate an application, you don't need to have the completed toxicology, but the FSA has to be satisfied that there is a process in place by which the toxicology will either be started or be completed and be made available in due course.
Yes.
So the sensible approach at the moment then would be to look at your manufacturing process, look at your the whole of the batch testing, and if I can call it the sort of the technical aspect of the dossier, and wait for advice which we believe is coming in September or October before committing what could be £500,000 on the toxicology work.
That would be prudent for the time being.
Thank you very. That's very, very helpful.
Francis, a question here about relative comparison and approaches to synthetic CBD and to CBD derived from natural or ingredients. And the question is this: EFSA have validated a synthetic CBD. If a CBD isolate derived from a natural source possesses the same chemical characteristics and the same biological fingerprint as a synthetically derived one, why is information concerning A, the origins of the biomass from which it originated, or B, the extraction and or processing techniques by which it is obtained, a key driver to the novel food application? Because by the time that it is a CBD isolate, it is a chemical ingredient no different to synthetic CBD.
So we need to be aware of any potential contamination. So we're aware that hemp is used as bioremediation for contaminated land. So obviously it does have a capacity to absorb heavy metals, that kind of thing. So we would want reassurance that that wasn't present in the product. We would also want reassurance on any residues from, for example, extraction solvents, just so that we can check that the analyses are adequate.
But you would certainly have that, because you'd need evidence of the testing of a minimum of 5 batches to show you the main CBD component and any contaminants. So you're going to have that anyway. So you will see that the product, the isolate product, is consistent with itself, and you'll know everything about the contaminants that are within it. And let's not forget, even in synthetic CBD, there are contaminants in there. So given that you will have the same information as you would have for synthetic CBD, why is the origin of the biomass and why is the production process a key driver, given that, as what the question says, by that point in time, you have a chemical component that you know what it is, which is the same and no different information than you have with synthetic CBD.
So as an example, we would want to know the production process and the storage process, etc., for the product. So we would want to be able to identify areas where things, for example, like aflatoxins could be produced. And if those areas were present in the production process, then we would obviously want to see an analyses for aflatoxins presented within the dossier. There's a lot of we have to do a lot of cross-checking just to make sure we've got all the right data. So the data isn't standard for every single product. The data that we would want to see will depend on the products that you're presenting to us, and that's why we would like to see a presentation of the production process and the biomass itself as well.
One can understand why you want to see a presentation of the actual ingredient and its chemical composition. But it's hard to see from that, given that by that stage it is a chemical compound as an ingredient, it's hard to see the relevance of the biomass where it came from or the production process, as long as the chemical component that is produced as a result of that process is consistent and you know what it contains.
It's an added layer of reassurance, isn't it? We want to know that you're not hiding anything from us, so we would like that information.
I'm just trying to work out what people should be doing now and how they would do it. So if we take five ingredients, we'll go back to isolates, and at the moment we're not going to untake the toxicological data because we're going to wait for advice. But what we need to demonstrate is we need to work backwards to show the manufacturing process to make sure that there is no risk or potential consumer harm associated with the journey from biomass to isolate powder. So each of those production methods can be different as long as they eliminate risk and there's no potential harm. So you've got 5 different production processes from 5 different sets of biomass. But the extraction process leads to a similar consistency, which will fit with the parameters which will hopefully be announced in September or October. And then they could go forward together with a collegiate approach to the in vivo work that needed to be done to satisfy the committee in toxicology and the science committee that risk had been addressed and safety issues had been addressed.
Mm-hmm. That would sound fair, yeah.
Okay. Thank you. So getting into a little bit more detail with toxicology and ADME, because I think there's 2 things. We've got the ingredient and then we've got the end product. I'll just read this question, which again came from an industry participant. So the FSA has previously indicated that a novel food application will not be necessary unless the new end product represents a different risk profile to those products which have already received authorization. What issues are to be taken into account when seeking to assess whether the risk factors are sufficiently disparate that the new end products fall outside of the qualifying criteria of the existing product? And I apologise for the length of the question, Francis.
That's okay. It's a fairly short answer. I think this would have to be taken case by case.
Okay.
And would that be by reference to guidelines that may come from your advisory committee in the autumn? I
think it would be case by case, so they would need to see the dossier to be able to make a judgment on that.
We've got some information from COT at the moment, though, where they were referring to the GW testing, the Fed tests, where humans, where they had milk, alcohol, fasting, and the FDA full-fat breakfast, and they showed that the bioavailability metabolism was vastly different. So, is there a list at the moment? So, if I am manufacturing, if I'm putting isolate into an MCT oil, and I then want to put that isolate into a drink, are there a list of other active ingredients that people should be concerned about at the moment? So, for example, are you looking or considering the effect of sugar, sucrose, agave syrup, those type of sweeteners? Are you considering that work needs to be done in the presence of artificial sweeteners, or are those parameters yet to be set? Because if it's a case-by-case basis, there must be some criteria which exist now to be able to judge that. So if I came to you unofficially for some advice and said, I'm making 3 soft drinks, I'm making 3 oils, and I'm making a granola bar. What ADME do you want me to conduct on each of those 3 product lines? Would that be something that you could advise on at the moment?
The testing that you carry out is up to the applicants. We can only offer some advice, and I would say, because the bioavailability is so different from different mediums, we would want to see data on different mediums that reflect the products that you're intending to use.
Okay, and again, that would have to be an in vivo ADME test. So obviously, ethically, you're not looking at the death of the rodents there, but presumably there'll be advice coming as to whether that can be in vitro or in vivo, and would that be expected at the same time as the other advice?
Again, the applicants would need to speak to their toxicology advisors who are carrying out the tests, but there are in vitro tests that can be carried out to look at various aspects of ADME, and these could obviously be utilised and would be a cheaper alternative to a rodent assay. And there are publicly available data on ADME, on CBD and other cannabinoids too. Okay,
so that so the position at the moment would be that you could conduct a research based, provided you had the permission to utilise that data, that it would be sufficient to rely on existing data which is there at the moment. There are no gaps in the ADME.
No, well, there are gaps in the ADME because, as you say, there are differences in the bioavailability from different mediums, and we don't know the impacts of those at the moment. So there are gaps. How those gaps are addressed isn't really for me to say now, but a proposal could be put forward, and we could have a look at that, ask the committee to have a look at that. But there are gaps in the data, and obviously any publicly available data that you use would have its own limitations in that you wouldn't have the final raw data, which the committee may well want to see in order to inform any decision that they make.
Okay.
When you talk about, obviously, a different risk profile and that everything is on a case-by-case basis, is it your intention to make available to the market information about where you see the relevant criteria or what the parameters are? Because approaching it as you in this manner, it requires every market participant to make a guess and then approach you and ask you if their guess is good, bad, or indifferent, which will lead to more uncertainty in the market and more questions posed to yourself on a case-by-case basis. Are you able to make available some policy or some principles that they can then apply in trying to come to their best estimate as to whether they do present a different risk profile?
It is something we could consider.
Because speaking personally on behalf of the Canna consultants, it's a big issue that people are trying, and I don't mean this, but people are trying to have to guess what's in the regulator's mind, as opposed to perhaps being given some insight as to what's in the regulator's mind. And a bit like we mentioned earlier about you would take advice from the advisory committee, whether you need to do that or whether you can develop policy internally, it would certainly help the market to have an understanding as to the regulator's thought process, rather than trying to have to guess it and then only find out when they make a final approach at the end of their guesswork as to whether that's suitable.
We could consider that.
The big gap in knowledge that we see is on how you satisfy risk and safety on toxicology and on ADME. So my question is, have you been able to give that advice on a case-by-case basis at the moment, or are those people being told to either take a punt, which is essentially what it is, or, as we discussed previously, wait until we get some more advice in September, October?
We have offered some advice on a case-by-case basis, sorry. and the applicants have obviously gone back and are sort of acting on that advice. Sorry, what was the second part of the question?
No, I'm just trying to find sort of a path through this. So if I have unlimited funding, the best that I can do is go down an in vivo route, do rodent studies and cover and tick every single box on my base ingredient, run my 90-day studies with recovery periods, and then find a scientist who will then design the test and all of the admin. So that would satisfy you. We know that what people are trying to seek is a pathway where they can do things together, so they can share information, where they can avoid rodent studies, and it's where's the middle ground there? Because I understand what you could achieve by throwing the kitchen sink at this, because that would cover absolutely everything. But is there a happy medium? So are you able to, on a case-by-case basis, say, we would accept in vitro, you can rely on this data, but there are gaps here? Because from what I'm hearing, it's sounding as if, and please correct me if I'm wrong, it's sounding as if there is going to have to be some in vivo toxicology conducted, and then the issue is whether or not that can be shared.
Okay. So yes, I agree, there will have to be some in vivo data conducted, in vivo studies conducted, because there are gaps in the data, and it can be shared. I think as you say, people have been providing us with their dossiers and we have been giving them information, and I would suggest that's a good way forward, is to provide us what you've got, and then we can have a look through and provide feedback on that and tell you what we think that you would need in future. But it is a case-by-case thing.
If a decision is made on a case-by-case basis, it means that if the regulator considers the issue in advance and the range of questions that may arise, it would have the ability to develop a policy as to which is a manifestation of case by case. And if that policy was developed and made available in advance of people starting the expensive task of toxicology and admin work, they could then target the work that was needed in the knowledge of the policy, rather than in the hope that their estimate of what might be the policy was accurate. Because one thing that many in the industry want to avoid is the duplication of in-rodent toxicology work on what's essentially the same ingredient through a lack of direction as to knowing whether they can work together, or whether certain of them can work together but not others because of the variation in their product in the first place.
Yes, I mean, we're not saying that companies can't work together. I think a collegiate approach or a consortium approach would be acceptable. And toxicology data, I've already said, toxicology data can be utilised for more than one product. So that would be a suitable approach.
But in that regard, let's take an example of 5 isolate manufacturers agree to fund equally the toxicology work and ADME work on one of their isolates. So rather than each conducting 5 lots of virtually identical tests on rodents, they will share the cost each, pay 20% each, and they choose one isolate. At the end of that process, they submit the data in relation to the toxicology work on that individual isolate, and they submit information to you about how proximate they say their isolates are to each other. And this covers the toxicology and the ADME work. And at the end of that process, the regulator returns to them and says, well, on this case basis, we think that they're not similar enough, and we will validate the one isolate upon which the work was undertaken, but we will not validate the others because we don't consider them of substantial equivalence. In that situation, one company has paid 20% and got 100% of the benefit to the detriment of the other 4 companies who've paid 80% of the cost and have no benefit. From a regulator's point of view, if you want to encourage the non-replication of toxicology data, is it not advisable to publish in advance your policy on it in order that people know in advance of that situation, of the starting the work, whether they fall within the remit of the policy?
Yes, so I have previously said that we would consider that as an option, and it is something I will take away and consider.
Okay. Thank you. All I would urge there would be, if there could be some agreement, and obviously the Committee on Toxicology and scientific team that you have are still considering these issues, the sooner they could issue that guidance, the more helpful it would be, because we see people from North America beginning trials already. We see people planning them now, and you only have to look on the internet to see the disparity of what's on offer. And people are committing large amounts of money for a paper-based desk assessment. People are committing large amounts of money for in vivo. And I know money isn't the issue, and I know we're talking about non-compliant companies, and I know people should have done this 2 years ago, but it would still be helpful, having offered this transition period and having set a new deadline, to steer those who do want to be compliant and come into line. So I have a huge amount of sympathy with your lack of sympathy, but it would help. So there's a request, Francis.
Okay. Yep.
It's not just the market participants, there is the ethical issue, because the next question we come on to, which is in the kind of topic of general toxicology and ADME, question from somebody put through to us to ask you is, how will the FSA ensure that there will be no unethical use of animals in replicated toxicology studies as a result of these regulations? I.e., what is the FSA going to do to prevent multiple replicated repetitious studies on animals for ingredients that may be engendered because of lack of knowledge on the part of the market participant?
So our priority is obviously the to ensure that the food is safe. So that would be our main priority. Every product is different, and our job is to make sure that the products that reach the market are safe. The onus is on the applicant to demonstrate to us that their product is safe by whichever means you choose. So that may not be in vivo studies, that may be other studies. But it's up to the applicant really to decide how they're going to do that.
But you've already indicated that because of gaps, in vivo studies are inevitably necessary. And therefore, if each market participant wants to ensure that they have the ability to bring the product to the market, in the absence of knowing information about substantial equivalence, they're all going to have to consider filling that gap on an individual basis rather than on a communal basis.
Not necessarily. The industry could work together to provide a suite of studies that meet the gaps that there are in CBD safety.
I think the likelihood of everybody working together would increase significantly if there were some clear guidelines. Perhaps they'll come. I mean, one concern for me is UK participants could be at a distinct disadvantage because the Home Office obviously is regulating whether these animal studies can take place, and we know that they're taking place at the moment in other European countries and abroad, where there are less, they don't apply the 3 R's, where there are less stringent adherence to ethical factors. So it may be that whilst your priority is safety for the consumer in food, which is quite right, the Home Office, and these are all arms of the state, will prevent a UK company from attempting to demonstrate that. And it would be their detriment to a company outside of the UK. So we could have European, North American, Canadian companies making applications to you, which and they have access to in vivo studies, which have been denied to UK market participants. So that's just another factor which is being considered at the moment.
Noted.
Mhm.
Would it be possible for the FSA as the regulator to give more detailed information about what it sees as the gaps that need to be plugged? You mentioned about that the industry could work together in order to plug the gaps on a communal basis. And what assistance can you as the regulator publish so that they know, the industry knows what you identify in your heads as the gaps, and that they can then set about plugging?
Okay, so the Committee on Toxicity, as I mentioned in my presentation, have discussed a position paper which they will be publishing within the next 4 weeks or so. I think it's just being finalised at the moment. And this will give a bit more detail as to the data gaps as they see it. I think some of the data gaps were already mentioned in previous COT papers, which members may or may not have seen. But I can advise on the main gaps, so that from the way the COT see it, there are gaps on effects in the liver, reproductive effects, long-term effects are still unknown. There's also some effects on drug metabolizing cytochrome P450 enzymes. Possible work needs to be done on somnolence, and people obviously wanting to drive after taking it. And also immunotoxicity, there's very little data on that at the moment. So those are the main gaps as I see them at the moment.
And that, would I be right in saying it's impossible to fill those gaps without in vivo studies?
It would depend. So some studies could be done in vitro, but it would be a suite of studies rather than an in vivo study. But that a contract laboratory would be able to advise on suitable studies for that.
Okay.
But there will be more detail in the COT statements that's coming out shortly. And
will that statement then fuel the advice that could come in September and October?
It may well do, yeah. I haven't seen the COT statement as yet, I'm afraid. But, yeah.
Okay, thank you. With regard to the testing of cannabinoid products, do you expect to see a full methodology for the analytical processes adopted in a dossier, or simply evidence of accreditation with UCAS, for example?
Okay, so we've actually instigated some work with UCAS and some UK laboratories to try and improve the analytical capacity for CBD and other cannabinoids, because we don't have a UK UCAS accredited laboratory at present. But we are working with them to try and influence that process and get that moving, so that there should be more capacity in the future. And I would say using a UCAS accredited laboratory would be acceptable. Yep. So we would need some information on the process, but obviously not the full.
Yeah, this question actually comes from Farah, which is Farah. So that, I mean, breaking it down, simply these are the results. It's so 17025. Is that sufficient, or do you want the scientists to actually break down and go past that accreditation and show you exactly what they're doing and what the methodology is for the testing? Because simply having the accreditation, we see a wide variation of results from different laboratories. So do you need that other level of detail? I
mean, obviously we would need different batches and variabilities between batches and that kind of thing, but I wouldn't say that we would need the full analytical process broken down into minute detail, as long as the UCAS accreditation is obviously current and valid.
So the next section, toxicology and ADME, the specifics of the work required. So the published data concerning Epidiolex recognises certain safety concerns regarding CBD, which are only seen at much higher levels than the 1 kilogram per day. In your current opinion, would it be likely that you would be satisfied that there was no toxicological safety issues from CBD on a review of the available and published data? And I'm assuming that would be in relation to somebody setting the dosage at a much lower level than that.
Okay, so I think the question itself is not quite correct, in that effects have been seen at 1 milligram per kilogram per day. And I think, going back to a previous answer, I think it's clear that there are still data gaps, which we are asking applicants to fill. We do not know the adverse effects. We do know adverse effects have been reported at 1 milligram and above level, so liver effects, for example. And again, to reiterate that the COT position paper will be available soon.
Okay. Do you have in your mind, have you discussed, do you think 25 milligrams per day is the most likely route for success? Is that something that's been discussed in the committees? Is that some advice that would come out? Or?
That's not, as far as I'm aware, I don't think that's been discussed. I've not seen a level of 25 milligrams per day.
Okay. And I pick that off the, pick that out of the air. At any level, Francis?
Only that we have seen effects above 1 milligram per kilogram per day, so that's the level we're working on at the moment.
Okay. And that's based on the GW data?
Above.
Yeah, that's based on
yes.
the GW data?
Yes, which is obviously medicinal data, which would be different to data that would be required for a food.
So anybody who is seeking to rely on that data is not going down the correct route, are they?
I think because whilst they've been, the producers of Epidiolex have been very helpful, they haven't provided us with the raw data, and they're quite within their rights to do that. And I think the committee would like to see the raw data before they can make any decisions on that in particular. So yeah.
And do you think GW would be prepared to share that with the committee only? Because I know they won't make that. It's not in their interest to make it public in the moment, it's their IP. But is your understanding, because I know it's been requested, that that's going to be given and then an opinion can be formed almost behind?
As far as I know, it has been requested by the COT, and it's not been forthcoming so far. But as I say, they're quite within their rights to keep that.
I mean, in one sense, if somebody proceeded to try and convince you on the basis of that available data what a safe level was, the whole situation could change if and or when more of that raw data became available to you and or the Committee on Toxicology. That
is correct, yeah, the situation could change, yeah.
It would be a big risk to make an assumption that there'll be nothing, there'd be nothing not advanced. So it would be a big risk to assume that the balance of the data would not be detrimental to the application or the overall position.
Yeah, for the supplement.
Yeah.
So, Francis, in relation to toxicology and ADME and the application of one set of data to different carriers or different delivery mechanisms for the underlying CBD, and we've got a number of questions now. The first of which is, if I undertake rodent in vivo toxicology safety studies for CBD in an MCT oil, what other carriers would the FSA consider substantially equivalent, such that it was not necessary to undertake the same studies in a different carrier/delivery mechanism? For example, would hemp oil, olive oil, almond oil, and coconut oil be considered substantially equivalent to the MCT oil upon which the original toxicology safety studies were conducted?
Okay, so the oil composition may well influence the absorption, although there's so little data that we aren't actually able to make a judgment on that. Obviously, sesame oil may have allergy implications. I know that's considered as a carrier as well, and nanoliposomes have also been discussed, and that their use may influence the absorption, but we obviously, again, don't have data on that.
So the responsibility would be for somebody to conduct the data, come to you, ask whether you thought that was sufficient. It may be that they would have to wait until the result of the Committee on Toxicology's report and some further advice, and then they would know whether to conduct more or that was sufficient.
Yeah, I'd say so, yeah.
Okay. Well, I apologise for the second question. We may be getting the same answer, but again, this is from a participant who's taken the time to submit it. So if I undertake rodent in vivo toxicology safety studies for CBD in an MCT oil, what other non-oil delivery mechanisms would the FSA consider substantially equivalent, such that it was not necessary to undertake the same studies in a different carrier or delivery mechanism?
So yes, it is a similar response, but it is clear that there are differences between absorption from lipid and non-lipid carriers. So we would want to see data on that. We don't have that data at the moment.
Okay.
If I undertake rodent in vivo toxicology safety studies for CBD in an MCT oil, can I utilise published data demonstrating the difference in bioavailability between CBD in an MCT oil and CBD in another delivery mechanism, such that it was not necessary to undertake the same studies in a different carrier or different delivery mechanism? And perhaps the follow-up to that is, what would the consistency have to be, which would mean that I didn't need to?
So I would say yes, that would be acceptable, as long as you can relate them to your product. And that would go back to the advice that we would hopefully be obtaining from the ACNFP on regards to specifications, that kind of thing.
As we sit here now, given the large disparity in bioavailability, would it be right for a market participant to assume that you would have concerns about utilising CBD in an MCT oil and CBD in a different delivery mechanism and trying to say that they were the same?
Yes, I would have concerns about that. I would like to see supporting data to back up any claims that were being made.
It's almost for the market participant to show that there is no difference in bioavailability if they want to try and have them treated as equal.
Yeah.
Okay, I think we've covered those. We are going to be asking the same question, but a broader one for you, Francis. Given that the Committee on Toxicology have started looking at topicals and retention and simply put ADME from creams and cosmetics, do you think that the industry need to consider the accumulative effects of multiple products for the consumer? For example, usage of ingestibles alongside topicals. And would you recommend any labelling guidelines, or is there something that's being considered by yourselves and the committees at the moment?
It's obviously been in the back of my mind. We understand that companies want to put these into a range of products, and obviously there would be the accumulative effects of that. People could quite well reach a dose that would have pharmacological effects by consuming 1, 2, 3 different products. Obviously CBD itself also and other cannabinoids have quite a long half-life as well in the body, so there would be concerns about any sort of bioaccumulation and people not realizing that if they take one product one day and then another product another day, that they may sort of exceed what would be considered a safe level.
Perhaps linking with that, another question is this: given the wide variation in bioavailability between products within different carriers and delivery mechanisms, how is it proposed to reflect those disparities within the dosage limitations or recommendations? So currently there's a 70 milligram per day recommendation, but given the impact of bioavailability, how is it to be reflected across the different products, and where people may be using multiple products?
Again, this hasn't gone to the committee as yet, so they haven't had a chance to consider that aspect of CBD products. So I can't really comment. But
let's say, for example, there's reported data that shows the bioavailability in beverages, in drinks, is greater than in, say, an oral tincture, and depending on what you consume in or around the time, whether it be high fat, low fat, fasting, the bioavailability varies. When a market participant submits an application in relation to a product, they have to propose a maximum daily dose or maximum daily intake. How are you going to reflect that referable to bioavailability? Because the daily intake that could have the same effect from a tincture or an oral gel capsule may be substantially different to the effect, because of bioavailability, of a beverage.
So the bioavailability should be taken into account in the dose that is stated as a...
I'm asking in that the real issue is what ends up being fully ingested into the individual person.
Yes, of course.
Depending upon the bioavailability, it is not simply a matter of a product saying this has so many milligrams of CBD in it, because how much ends up in the body is impacted by the bioavailability of the delivery mechanism. So setting simply a milligram per day does not necessarily assist a consumer, or indeed a manufacturer, with deciding what they want to be able to say about it. Because a consumer may think to themselves, well, I'll take 70 milligrams in oral tinctures, or I'll take 70 milligrams in a beverage, but the actual amount that ends up in the individual could, depending on the results, be substantially different between the two delivery mechanisms. How is that to be reflected when an applicant is trying to decide what they want to put forward as their voluntary limit that they will make consumers aware of?
Okay, so that will form part of the ASNFP considerations when they're looking at the different products, and they will make a judgment on if the data is available. They will obviously make a judgment on the different bioavailabilities from the different products, and sort of balance that out with a sort of profile of products that would be acceptable, I guess.
And can we just clarify who the they is?
The ACNFP.
So your advisory committee?
Yes.
And will they be putting their mind to that in September?
Hopefully, yes.
Thank you.
Okay, well, that was fascinating, is one way of describing it. I think to summarise that, I think my understanding would be that this is a work in progress. I think what we understand is that there's been a massive restructuring. So we have this sort of three-tiered approach. We've got the Committee on Toxicology, which is in turn going to advise the AFFF, which is the Advisory Forum on Food and Feed, and then alongside or underneath that, you've got the ACNFP, which is the Advisory Committee on Novel Foods and Processes. I think that recruitment's been taking place. And for Francis to tell us that we already understand there are gaps in the data, but that the Committee on Toxicology is imminently releasing a report, and I think she said in approximately 4 weeks, which will address the gaps in the data and the concerns about the risk of CBD products. But the policy doesn't exist, because the policy can only be based on the advice that comes from the scientific committees. So what do we take from that? I think we have agreement that the only way to satisfy that policy, and we know that now, it is from in vivo, so from rodent studies. So this opinion that's out there from certain quarters that you can conduct and complete a successful dossier leading to potential market authorization from an academic desk-based research of existing data is just untrue. Not just because the actual underlying data isn't available, and we're well aware that a number of the people that conducted this research aren't actually handing over the nitty-gritty that lies behind it. It's just the headlines. But I think it was also, for me, it was quite illuminating that the gaps in the data are maybe slightly bigger than I thought. I mean, we were aware of genotoxicity, we were aware of, you know, liver interaction, we were aware of the issues around reproductivity, and all of that came from the GW work. But there's sort of the mention of somnolence and the concern about people driving. So whether we're going to be entering a route where using CBD is not safe at certain doses for people operating machinery or driving, but bioavailability will in turn affect on each different individual product. If we, again, as we know, the Committee on Toxicology are looking at the GW data. And we know that the Committee on Toxicology asked for further data from GW, and as Francis stated, they haven't received that, nor are they likely to, certainly not the underlying data. So for me, the message was, and I'll use her words, it would be prudent for a company not to undertake or commence scientific work, so which is the most time-consuming element, because as Francis agreed, you know, the planning and the actual analysis of you know, a 90-day recovery plus recovery study, or whatever type of science you're going to conduct, can take 5 to 7 months. So the positive from that was we will get information, hopefully, policy will be created and we'll receive advice in September or October. But then when you look at that, you think, okay, if the report comes out in approximately 4 weeks' time, that takes us into August. There's a summer recess. We know that even if teams are working, there's a break in every chain, so it's very difficult to have committees sitting together. So if that takes place in early September, it's going to be October when we get this information. But they can see that despite what certain members of the industry are saying about having to have everything completed by the end of February to give the agency a month to validate it, you can submit a dossier early next year to the FSA, which doesn't have the toxicology data in it or the ADME work in it, but it must be planned, and you must have the laboratories and you must have your advisors engaged, and you must be able to demonstrate that it's going to take place. So that was good. I thought that was a good takeaway. I have a huge amount of sympathy for those people who have undertaken, are currently undertaking, or are about to undertake massive financial commitments with regard to this type of research, which is a punt. It's a best guess. So another takeaway is anybody telling you that they know exactly what you need to do, well, it's not right, is it? So from my perspective, Matt, it was engage with the FSA and have a certain amount of sympathy with them with the restructuring, engage with them at the earliest stage. If you're not doing this now, you should be doing this now. You need to start doing it as quickly as possible, and look at all of the other technical data. So look at the production process, look at the batch testing, look at all of the cannabinoid testing that you need to do, and look at the stability. There's a huge amount of information that can be gone and gathered and examined at the moment, and then engage with people and have advisors and have scientific advisors who are in a position when we get this advice in September or October to act upon it, and then take that time and act swiftly to plan how you intend to satisfy the risks that are identified. But I found it exceptionally honest. I mean, I am astounded. I thought a policy existed. It doesn't. It's clear it doesn't. And I have a huge amount of sympathy for people who have submitted dossiers or committed large amounts of money, and they may well have to start again with a blank sheet of paper in September or October.
Yeah, well, you know, it would have been natural and reasonable to assume that in the 12-13 month period between when CBD was classified as a novel food and when the FSA made its announcement in February of this year, that during that period, it would be reasonable to assume that was the time when the FSA was deciding their policy as to what would be required vis-a-vis CBD and what would be required for market participants to do. It seems that now that isn't the case, and that they're still deciding. And of course, it is a new field. There isn't a great deal of data out there, and of course they will respond to that information that becomes available to them, and they can only respond when it becomes available to them. But what we see now, and what we hear from both Paul and from Francis, is that in essence, when one considers toxicology and ADME, nobody is going to know the FSA's policy until at least, in realistic terms, the end of September or October. If their advisory committees are not sitting and discussing these matters until September, then the way these bodies work means that it's going to be at least a month before that comes out. It will have to go through the various policy departments in the FSA, and it is unlikely to come to the market until October, probably even November. So what it means really is that the toxicology and science work is going to have to be the last thing that people ever embark upon in relation to their novel foods applications. What they should be doing now is dealing with all other aspects of their dossier. And when we heard from Paul earlier that of the 10, just less than 10 applications that they've got in, ignoring the science side of it, none of them would achieve validation. So it shows us that when dossiers are being submitted, or certainly the ones that have been submitted this far, it is not a tick box exercise for them to be validated. Anybody only beginning that later this year or in January is going, or may well find, that they cannot respond to the needs of the FSA, the requirements of the FSA for further information. They cannot respond to that before the end of the deadline. And the FSA will have every right to turn around to those individuals and say, well, you only came to us in January or February. Before then, we didn't know that you had any intention to make an application. And when you submitted your dossier to us, we responded within the 4 weeks that we are required. If our response meant that you have to get more information and that would take you beyond the end of March, that's not our fault, would say the FSA. And they'd be entirely right about that.
They would be entirely right. And I do sympathise with them a bit. I mean, look, there's been the perfect storm, hasn't there, Matt? We've had Brexit hanging over us like a sword of Damocles. Brexit's taken place, it's not taken place, it's delayed. So then we've left the European Union. We've got this transition period, we've got the withdrawal period. We actually don't know when it's going to end. So the FSA have taken part with EFSA up until very recently. They're now excluded. They've had to design their own department. They've had to design their own processes. They've had to design their own portal. It's a fairly small department. We understand that they're recruiting extensively, another 140 people, scientists and the like. And there hasn't really been the consumer detriment from CBD. There's a worry, you know, there are talks about what it can and can't do, but we haven't seen people falling over in the street. So I think they now have channeled their mind to this. I think now is the time when they are looking at CBD. Now, it was evident from Francis that there's a lack of sympathy from the industry. And I sympathise with her, and I sympathise with the regulators when you have non-compliant people and you have people acting unlawfully. Now, had they considered with the EFSA's position, which is all these products are unlawful and you must go through the whole of the process before you can put a product on the market, that would have been fine. My sympathy ends when you have a situation where they come out with a statement that they made in February, which said that there's a firm timeline now. Here is a transition period. We're giving you all a free pass. The rest of Europe may treat this as being unlawful, but what we are saying is you must submit a dossier by the 31st of March and you can keep your products on the market. Now, having done that, having given people that encouragement and having actively encouraged people to embark on this expensive and time-consuming, and rightly so, process to ensure consumer safety, you can't then retreat to the position and say, well, you should have done this 2 years ago. People didn't do it 2 years ago. They've now been told that they have until the 31st of March. That's the only date that matters. And there should be a more open, potentially, should be a more honest approach to the fact that we're actually still inventing the wheel here and you're not going to get this information until October. And that could have prevented, and it certainly will prevent now, hopefully, with people viewing and sharing this information, unethical studies in animals, commitments to financial arrangements which could turn out to be a punt or a best guesstimate, and people going down a collegiate route when in actual fact, the collegiate route may well be one of the best opportunities, but that's not going to be until October or November of this year, when we can establish what is required and which groups of companies could come together to pool their resources to address the risks that are there and then share that data. But as we know, we've got some companies who've already committed that resource and finance, and there's a reluctance to share data, much as there's a reluctance from GW, which you can understand. There'll be a reluctance from some of the other players who've conducted this toxicology testing. If they are to share it, what we now know is that what they are intending to share may well not satisfy the policy that is yet to be created. So I found it, at one hand, I have sympathy with them, but I think they made a rod for their own back by creating this transition period, and I call it that, providing this new date and actively encouraging people to go down a route. And at the moment, it's a blind route.
Well, it's having set a date before having thought about or defined your policy. There would be no issue here if they had their policy set and then they gave a defined date, because they could make market participants aware of the policy from the very day of the announcement. And what's unfortunate is that after years of market participants railing against regulation or trying to do all they could to ignore it or avoid it, we now have sensible market participants coming to the regulator to want to know policy so that they can put it into practice, and discovering only through this mechanism that we've put forward that actually the policy isn't there, and all they can be told is come back in 3 or 4 months' time when we might have defined the policy.
Yeah. The common sense approach, Matt, has to be the 31st of March is a deadline for the industry, and it's a deadline for those who are serious about producing high quality, fully compliant products, having addressed all of the risks or intending to address them, and it's a deadline for those who have no intention whatsoever. So hopefully we'll see the market clear, but we shouldn't be potentially penalising companies who are now on the back foot, or already trying to meet what I would now say is an unrealistic deadline, although we've had the clarification, and I think that's very important that is officially released to market participants, that providing you are doing everything that you can do, because you can't conduct that science at the moment ethically, certainly not in the United Kingdom. The Home Office wouldn't grant you the ability to do that when you didn't know what the policy was with regard to the risk you're trying to address. So I think as long as that's clear, as long as people engage now, they indicate that they've started the process, they seek advice, they seek clarification, they do everything that they are possibly capable of doing, with the exception of that which is reliant upon the policy that is yet to be created.
Yeah, I think what market participants can't take away from this is what the temptation may be, is, well, actually, I need to do nothing myself for the next 3 or 4 months. That's not the case. The market participants need to keep their foot to the floor to ensure that in all respects, other than the science and toxicology and ADME work, they are pursuing they are progressing their dossier creation, so that there is nothing beyond the science which is going to cause any problems for them. And I come back to it again, that the applications submitted this far, even ignoring science, would not receive validation.
Yeah, and that could be because the science hasn't been conducted. I mean, you know, in an ideal world, the science that's in the process of being conducted or is completed and being analysed or is planned would satisfy all of this, and that would be wonderful, and everybody will meet the deadline. But what we now know is that's a punt. That's a best guess, and you cannot run a business. You can take risks, but this is so much more than a risk. So the window, you're quite right, the window's shrunk. People have to be working on this now. They should have been working on this for 2 years. They should have been actively doing it since the 13th of February. Anybody who's not needs to be active very, very quickly. And then you need to have, as you say, all of your ducks in a row and be absolutely prepared with all of the other work and your engagement, so that in the short window that exists after we receive this advice, all of that scientific work that needs to be conducted can be booked in and conducted.
But also, one assumes that upon reflection, and let's say in January or February of next year, when assessing the state of the market and when assessing the state of their regulatory structure, if the FSA have got engagement from a substantial number of market participants who are doing everything that they can to be compliant, leaving aside the toxicology that will not have been completed, they're going to, well, one would hope that they take a certain view about those people who have demonstrated by their words and deeds and financial commitment a desire to be compliant. One would assume that they would take a certain view about those people and perhaps a distinctly different view about the old dinosaurs, as it were, who are railing and have always railed against regulation of any form without justification.
Yeah, absolutely.
So
we all want the same. We all want the same aim, and we all want to cross the finish line. It's whether you have to finish the race when you go across the line, or whether you keep on running. And I think, you know, this term substantial equivalence and the tolerated differences between ingredients and products, that can only be advice that comes from the regulator. Surely we can't be expected to embark on a collegiate application when we don't know whether the variation that will be allowed is 1% or 5%. The risks there are too high, aren't they?
Well, the example I gave in our discussions with Francis is that 5 companies come together to try and do the right thing ethically and for the market and for the regulator, and it could turn out that one benefits entirely and the other 4, who've paid 80% of the cost, benefit to the tune of absolutely nothing. Now, again, it's that type of issue that one would have hoped would have been sorted out before now in order to bolster and encourage potential collegiate applications. At the minute, anybody who is thinking of joining a collegiate application can have discussions about it, I would suggest, and can think about it. But one can't see a circumstance where they'll press the button to go ahead with it when they don't know whether they will win or lose out of it. I mean, out of those, the example we gave, one company wins hugely to the detriment of its immediate rivals. And that's like a game of Russian roulette with your business. One can't imagine that that's a sensible decision that any chief executive or committee or board would ever be willing to take. It's a gamble, which means that you benefit your direct rival and you may be hold below the waterline to sink without trace. One can't see that that's a sensible way forward. And therefore, collegiate applications, it seems to me, are now on hold until the FSA come back with some information about the range of disparity from the baseline, from the median, or from the isolate, or the commodity that's to be submitted for analysis, the range from the median as to what's acceptable.
Yeah, I mean, even if we believe that the Committee on Toxicology draft position paper is drafted, and we're waiting for it to be released. So even if you imagine that participants within that know the content of it and the commercially advantageous position of being able to sort of guide some kind of scientific work, notwithstanding that, it's not going to be COT which decides the policy. It's then going to be filtered down, and it'll be the FSA in one of its committees that decides that. So it's still a punt. And even if you identify the risks, I think the substantive equivalence is the biggest sticking point for a collegiate application, because unless you have, and I go back again to Paul, I mean, when you talk about exactly the same product, same manufacturing, same risk, it would have to be an exact match. You would need absolute assurance. That does not seem to fit with the wide variation that we see in, not necessarily the quality, but the composition of a lot of these active ingredients.
Well, in the examples that we gave one that was 99.2% with 0.8% of variation of other cannabinoids or contaminants.
Yeah, that would be fine, she said.
Yeah, but then 0.9, 1%, 1.1%, where stops becoming it. And the point that I tried to make to it, that, well, if you put your mind to it now, you can almost define your policy now by thinking about it now, as opposed to only thinking about it when people come to you and say, our variation from the mean is X, Y, or Z. I suppose in one sense we could go on discussing some of this lot forever and a day.
Yeah, absolutely. But the takeaway's got to be, you're right, this is not a holiday, this is not a stopgap. I mean, I used the word the clock stopped before, but I think the clock stopped on science. But when you look at the dossier itself, that's one element of it. It may well be the most expensive, but there's a huge amount of work that needs to be conducted, and that's got to be taking place now.
All it's done in one sense is that it's moved the spotlight, the immediate spotlight, away from science and moved it onto everything else.
Yeah, I agree.
Science now has to take a backseat. Companies have been wanting to get on with it because they know that the science takes time, but the science will now have to move to the back burner until that policy comes from the regulator. But it does mean that everything else now comes to the fore, because the only way in January and February of next year you will be able to positively satisfy the regulator that you've done and are doing everything that you can to be compliant is if everything in your dossier other than the science is there, is complete, and is acceptable. Yeah. And from what we know of the history of the FSA thus far, is simply because you submit a dossier, it is not a tick box exercise that it means it gets validated. So companies now need to be focusing on the whole of their dossier, not just the science. The science will have to catch up as and when policy that defines what's required emanates from the regulator.
I agree. We need to actively engage positively with the regulator. There's no point railing against them now. There's no point arguing over this. We need to engage with them, and we need to act now.
Let's hope the market participants proceed in that same way.
Yeah. Okay. Well, I address the audience now. I hope you've enjoyed the webinars. We've certainly found it exceptionally helpful. I would like to thank RASB Media, the organisers of the CBD show, because they put a lot of time, resource and financial commitment into this, and we certainly couldn't have done this without their help. I'd also like to thank Paul Tossell, and I'd like to thank Francis Hill. I think, yeah, it was a very frank discussion, and I would hope they would engage with ourselves and industry participants going forward, and I've no doubt that they will do. Finally, I think this has been good value for money, considering this hasn't cost any of you a penny. And I would like to direct you to our Just Giving page, because I think this is worth you putting your hand in your pocket and thanking our wonderful NHS. So from Matt and I, from RASB Media, from the CBD show, thank you very much.